Thank you all for being here this afternoon. We'd like to share some updates on COVID-19, the new coronavirus. As the Department of Health and Human Services shared earlier today, North Carolina has identified a second presumptive positive case. The person is from Chatham County and is in isolation at home and doing well. He had traveled to Italy in late February and now has tested positive. The Chatham County Public Health Department is working to identify people he was in contact with to monitor if they develop symptoms, and we have the Chatham County Health Director here with us today. Earlier this week, we identified a person in Wake County who tested positive for the new coronavirus, and he remains in stable condition and in isolation. Our state has been preparing diligently since well before our first case, and the CDC's assurance that the state would get additional test kits has been central to the state's planning. We know that it's important to get people tested. It's clear that North Carolina and other states need more test kits from the CDC. I've spoken with Vice President Mike Pence, and Secretary Mandy Cohen has sent a letter to the U.S. Department of Health and Human Secretary Azar outlining this critical need on behalf of North Carolina. We face this issue because of the increased demand for testing, as well as the new guidance on who should be tested that came from the CDC just this past week. We are doing everything that we can to get more test kits, and we aren't out of them yet. We are encouraging private labs to produce their own test kits, and this is happening now. In fact, we know that LabCorp is producing test kits and we are encouraging the FDA to approve more private companies to produce these test kits. As testing increases, we know that the number of confirmed positives will go up. People will read more and talk more about this virus, and I understand that people are worried. Know that the health and safety of our state is a top priority, and we will continue to approach this situation aggressively. I encourage North Carolinians to continue common sense steps to protect themselves and stop any potential spreading. Wash your hands often. I know most of us are doing that these days, but continue to wash your hands often. Cover your face when you cough or sneeze. Stay at home if you're sick, if you possibly can. We must rely on facts instead of fear. As we all approach the coronavirus in our own communities, we must rely on facts. You can get those facts from the website at the North Carolina Department of Health and Human Services. It's ncdhhs.gov/coronavirus. We also advise you to contact your local health department with questions, or your medical provider, your doctor, someone who takes care of you and your family if you have concerns about the virus. I have with me today the Secretary of the North Carolina Department of Health and Human Services, Dr. Mandy Cohen, our State Public Health Director, Dr. Betsy Tilson, the Secretary of the Department of Public Safety, Eric Hooks, and we have the Health Director of Chatham County, Leighton Long, here, and Brian Tipton is doing our sign language interpreting. But I'd first like to ask Dr. Cohen to come up and give us a few words from her perspective. Dr. Cohen.
Thank you, Governor. As the Governor mentioned, we've been working proactively to prepare for COVID-19 in North Carolina since January. We've stood up our task force. Our state lab began testing earlier this week. We've been aggressively focused on containment of the virus. We continue to collaborate with our federal, state, and local partners and get guidance to folks so they can prepare. But let me get into more detail about what the governor mentioned related to testing capacity. Although we made plans based on assurances from the CDC, we, like many states, have not received the supplies to run the tests that we need. Currently, the state lab, we have on hand enough supplies from the CDC to test approximately 150 people. While we continue to work with the CDC to get additional supplies, we have also gone directly to that supply manufacturer. They've been able to send us additional supplies so that we can test another 500 people, and those supplies are on their way now. While this amount is less than what we need to test everyone that meets the new CDC guidelines announced earlier this week, it's a start. Plus, we are working with our state partners to expand testing, as the governor mentioned. We signed an agreement with UNC on Wednesday and Duke on Thursday so they can begin to test starting next week. However, the shortage of testing supplies from the CDC will also hamper their ability to test the number of people we should be testing. I also spoke with the CEO of LabCorp this morning. They began testing for COVID-19 last night and are ramping up their capacity over the next several weeks. They'll be testing patients from all over the country, though they are based here in Burlington. They'll be testing folks, and they believe they'll have a turnaround time about 3 to 4 days. Our state lab currently right now has a turnaround time of 24 hours. LabCorp is going to be using their own tests, so they won't be limited by the supply issue that we're experiencing at our state lab. So this will help with some of the volume that we are going to see, but it's going to take some time to ramp up. And I understand that people may be feeling anxious or scared, and while we see more cases, I want to remind folks that there's really no need for panic. There are simple actions, as the governor mentioned, that folks can take to stop the spread of the infection. It's the things we've been saying over and over. Wash your hands. Use alcohol-based sanitizer for soap. Cover your mouth or nose with a tissue or your sleeve, not your hands. I said this to my daughter this morning. Avoid exposure to others who are sick. Stay home when you're ill. And make sure that the information that you're getting is accurate. I encourage you again to check out our website, ncdhhs.gov/coronavirus. And with that, we will turn over for questions.
You want to come forward and give a little overview of Chatham County? We'll have Mr. Leighton Long, the Health Director of Chatham County, and then we'll take questions.
Good afternoon. Our staff are continually monitoring this patient. This patient is being very cooperative and complying with all the directions that our CD staff or the communicable disease nurses are providing them. So we, at this point, he's doing well, and we fully expect him to remain in isolation as he has agreed to do without any issues. We will be continuing to follow state guidance under the Department of Health and Human Services recommendations with testing and follow-up and stay in full compliance with CDC protocols.
Well, now I'll open it up to questions. How about get the mic there?
Dr. Cohen, would you mind? We're talking about facts, not fear. We're hearing from a lot of viewers who want more facts. And clearly you're following CDC guidelines on what you release and what you don't. Can you please articulate beyond its CDC guidelines why you're only releasing a certain amount of information? Is it because you don't want to create more fear? Is it because of privacy? Is it all of the above?
Sure. So when we find out of this now new second presumptive case, we want to be able to release information to be as transparent as possible so that folks know that we are taking care of the and protecting the health and safety of our state. But we do want to protect this individual's privacy. Obviously, there's a lot of attention being paid to all of these cases. Want to protect his privacy, but we also want to give our public health team the appropriate time to make sure we get the facts right. And that does take time for us to sort through the details, make sure that we are truly understanding all of them, because we want to get out accurate information. That takes time. And so as we are able to have more information, we want to share it with folks, both to help them understand and to make sure that they don't feel panicked, so that we will continue to do that as best as you can. And I encourage you to be patient with us as we do let our public health experts do their work.
Yes.
Hi. President Trump recently approved funding to fight the virus. Will any of that funding trickle down to North Carolina, and how will it be used?
We fully expect funding to come from the federal government, and we're pleased that this legislation has passed. There are a lot of needs. For example, testing. We need to make sure we have funds for that. Ramping up for medical attention for people. We want to make sure that we have the funding to do that. We are working very hard to make sure that businesses have assistance. We may need a situation where there will be small business assistance to businesses that have been hurt by this. So we're going to be preparing a long list of funding that we need, that we are submitting to the federal government to try to get some of that funding to come to North Carolina. And Dr. Cohen, if you wanted to, that's good.
Governor and Dr. Cohen, do you have faith in the CDC and the federal government in coming through with these supplies? I know you said that having the testing kits is central to your plan. Are you coming up with contingency plans now because you just think maybe they won't come through?
Well, first, yes, we already are coming up with contingency plans because we have not received the supplies that we need. We have, let's don't get confused, we have adequate capacity to test. There are supplies, however, that you need to be able to extract DNA to be able to analyze the sample. And our lab has been waiting for these supplies from the CDC, and they had been promised these supplies, and they have not come yet. So that affects the capacity for us to test. I think our lab and our department has a great working relationship with the CDC, but on this particular issue, the lab has not received the testing supplies that it needs. And so what we are doing, that's one of the reasons we've approached the private labs to get them up and running. It's the reason that the department has approached the supplier directly to say North Carolina needs additional supplies. And Dr. Cohen, you may want to. Okay, I covered that one too. Yes.
In addition to the 2 presumptive positive cases that we have so far, has anyone else in North Carolina been tested for COVID-19? And then a follow-up to that, you mentioned that currently it's a 24-hour turnaround time with the state lab. But if you do have to use another lab where you said there's a 3 to 4 day lag time, are you going to put in any measures in place, for example, a self-quarantine for those people?
Yes, so let me start with yes, we are testing others in North Carolina for COVID-19 right now, and we have been for a number of weeks. So it wasn't until this week that we actually had our first positive, but we have been testing folks along the way, and we will continue to do that. And as we are able to increase our testing capacity, and as we see if we have other cases and then we do tracing, we will need to continue to test others that may be having symptoms and may have been exposed to the virus. So we will continue to do that. And then the second part of your question.
So currently you said you have 24 hours turnaround time. If you have to use another lab or 40 lab time, will you ask people to self-quarantine or something like that while they're waiting for the results?
Thank you. So yes, we will be asking folks to stay in isolation while they are awaiting those test results. So yes, which is why we want to make sure we're trying to get capacity up so folks, we can limit the amount of time where they don't know what their test result is. Obviously, if it is positive, they need to continue in that isolation, and that is what the gentleman in Chatham County is doing right now. Thank you.
Yes. Can you give her the
So I know that you heard that this family contact group
Dr. Tilson.
Yeah, so what we know, again, is this man traveled from Italy, and then how we learned about him is that the Georgia Department of Health contacted us to let us know that he was had contact with a known positive. I don't have the details of that other known positive, but what the Georgia Department of Health conveyed to us was that he was a known contact with a positive. That's how we were able to identify him.
Can you explain what known contact means?
That I don't have that level. We did not get that level of detail. What we got was we know that he's a known contact of a positive, and we got that through the Georgia State Health Department.
Following up on that, did he indicate why he did not self-report, considering he had the symptoms, was in Italy, unlike the first case that we have as a presumptive positive?
Yeah, I'm happy to take this and then have Director Long add to it. So when he was in Italy, he had 2 days of very mild symptoms. His fever went down, his symptoms were getting better, and so then he came home, and he was really without symptoms. However, because he did know that he had been in Italy, even though he really wasn't having any more symptoms, he actually has been at home, isolating at home as much as possible. And then it wasn't until we got notification from the Georgia Health Department that we realized that he had that contact.
Just a follow-up. In regards to transmission, this whole issue, he was apparently not symptomatic, at least as much as he was in Italy. During that time, is it your feeling that even though he's now a presumptive positive, that he was not in a position where he's going to transmit to many people?
Right, so this is different than our first case from Lake County. So because he had symptoms, even though they were resolving, we are considering him contagious from when he had that symptoms up until he tests negative 2 tests in a row. So yes, we are considering that he was contagious from that first time.
So, questions that
He flew through from JFK through RDU.
when you say isolation, what does that mean versus quarantine? Is that
Yeah.
if they're staying in the house, if they're staying in one room? You know, what kind of contact? Are they able to perhaps infect family members that are in the same house with them? What does that look like?
Yeah, so let's talk about the difference of isolation and quarantine, which is a really important distinction. When someone is sick, they're in isolation. If somebody has contact with somebody who was sick but not yet sick themselves, then they're in quarantine, waiting to see if they'll develop symptoms. So that's the definition of those two terms. In this case, for example, he is isolated at home. His spouse is in the house with him as well, and she there is in quarantine. She does not have symptoms. She is in quarantine. And what will happen was then his wife will remain in quarantine for 2 weeks after there is no longer an exposure. So after he tests negative, then she will have 2 weeks of quarantine after that.
Can you give us a time frame when he landed in RDU?
Can you get the mic, Cullen? Can you get the mic?
Can you give us a time frame as to when he landed and?
Yeah, so we're still working through a lot of those details. I mean, and I want to say that I know there's been a lot of interest specifically on exact time frames and where would people go, and I get that, and that understanding people's concern, was I at risk, was I exposed, underlining a lot of those questions around timeframes, which is really important and a really, really valid question. And so what I want to talk through with you all is this concept of risk and the concept of our work of our local health department. So just remember that what is considered at risk in terms of contact is very close household, close household contacts. They are considered high risk. People who had sustained and close proximity contact with this person, so less than 6 feet away for more than 10 to 20 minutes, that's considered moderate risk. If you are just walking through a public setting, you're walking through the airport, you're walking through the grocery store, you're walking through the library, and by this person, that is not considered risk. So it really is those moderate and high risk people that the great work of our local health departments are doing to identify and to monitor those. But just walking through RDU on that day of landing is not considered at risk.
So where in Italy he was, how long he was there, or where he might have been exposed?
We know that he was in northern Italy, but I don't have the details of the rest of his exposure or trip there.
Yes.
All right. Don't like to trump the governor.
Isolation and quarantine. So are these patients, are they being visited by public health workers? And then how are those public health workers being protected when they're visiting? And then also, Dr. Cohen has said in the past that we should expect more cases. As this continues, we've had a lot of cuts to public health funding over the years, and we've had a diminishment of the number of public health workers. We're going to start getting fatigue, or how do you plan on dealing with just the increased case load of work for these people?
Yeah, I'm going to leave it to Director Long to talk about your first question. And, okay, great. I lost track of the second one as well.
With respect to the staff, we have very highly trained communicable disease nurses that are visiting them, and they have been obviously trained in management of and control of infectious diseases. So they are very familiar with protective equipment, and they are certainly applying those standards as they visit the home. At this time, they are, like I said, engaging with them. Matter of fact, they were up there this morning and getting some additional information. What their next steps will be to continue to probe into if there are any additional contacts that they need to follow up on, as Dr. Tilson described them.
Sure. Just to address first our capacity of our public health system, and I think, Rose, you know better than others who've been tracking this, that we have had cuts to our public health system over the last number of years. But what I would say is that we have recently been given a very high grade from Trust for America's Health in terms of being in the top quartile, being ready and prepared for this kind of work. I would say that we are mobilizing resources, not just from public health. We have our colleagues here in emergency management, and we are working very closely with our hospital partners and the clinicians who are in the community, who are really going to also be on the front lines with us as we work through the next days and weeks. And as I said, we will likely see additional cases, and we will do this work in partnership with them. But we'll go back to the question the governor addressed earlier about funding. We will need additional resources to be able to do this work and to do it well, to make sure that we're protecting the workers who are on the front lines of doing this work, as well as making sure that resources are not a barrier for someone to come to get access to testing and treatment if they need it.
I had a question in regards to testing. You say you want to do more testing, you're still waiting. Have you identified people in North Carolina that you intend to test, you want to test, you can't yet? And if so, what do you tell those people?
Sure. So right now, for folks who want to be tested in our state lab, given our limited capacity, you need to go through our epidemiology team. We will have a clinician would call that team, would discuss details of the case with us, and we try to prioritize. We want to make sure the highest risk folks are really getting into the testing queue. So what we are seeing more is that we are testing folks in hospital settings, often at this point, or those who have a known contact like this gentleman we've been talking about today. So that is the triage process that we're going across right now. We would like the CDC did change their guidelines earlier this week to allow us to test more folks. That is the direction we'd like to be heading in the next days and weeks as we progress through this. We need the testing supplies in order to be able to do that. We're hoping to be wrapping up our capacity to meet that demand. So often it's a conversation to test for common viral illnesses first, right? It is still more common in North Carolina for folks to be tested positive for flu than you are for COVID-19. And so I'd say We are still in flu season. Get your flu shot, and all the things to protect yourself from the flu are still, we want to be advocating. And often the folks that we have been testing come back positive for flu. And so we know that, that we don't need to go down the path of looking for COVID-19. Again, as we move through this, that may change, which is why we want to make sure we have the testing capacity to be able to know how to identify folks.
I want to go back to asking about the flight, because when people heard maybe RDU to Seattle, maybe not as popular a route as RDU to JFK, which is a very popular route, and unlike a bigger jet that would go cross country, regional jets, much tighter, limited spaces. So are you requesting the flight manifest for that flight? Are you reaching out to other passengers? What do we know? Because I think if people hear that it was a JFK, really anywhere from New York to RDU, a lot more people are going to pique. This is going to pique their interest. So what do we know about the date, the time, and are you requesting the manifest?
Sure. So we are getting the exact details of that now, and that work is done by the CDC. So the CDC, not North Carolina, does the work of getting to the manifest, getting to folks, and then contacting them, because they may, their final destination may not have been here in North Carolina. They may be in other places. So that is the work that they're doing. So we have gotten in touch with the CDC, and they are sort of taking the next step here. I do want to expand on what Dr. Tilson mentioned about risk, right? Even on a plane flight, when we look at the CDC guidance related to risk, even on an airplane, we're looking at folks who are in the general proximity, right, within a certain number of seats. CDC has even quantified the number of seats that they would say are in a higher risk zone. And so they are doing the ones to tell folks about different levels of risk that they may be at. And that's the kinds of conversations that we're going to be having with folks, levels of risk, and wanting to make sure that they identify themselves to their clinicians if they're having any symptoms, and to get tested.
With the first case in Wake County, we know that the man went to a restaurant in Raleigh and that you all have been in touch with that restaurant, and they went ahead and sanitized it. What kind of guidance are you giving these businesses where patients may have gone to, and should people feel comfortable going back to these establishments?
Sure. Why don't I have Dr. Tilson answer this?
Sure. And we were pushing out a lot of guidance to our businesses, not just if there was a known case, but for our community as well, and especially during flu season. It's all the same with flu season, right? And so we're talking to a lot about our businesses, again, protecting their staff, making sure that the staff is washing their hands well, making sure their staff isn't coming in sick, and then also making sure that surfaces are being washed down, especially high traffic surfaces are being washed down as well.
In regards to concerns that people have maybe about their own symptoms, they're just unsure, are we to a point at all where local public health departments have become overwhelmed, or is everything okay there? And if people do have questions, what would you tell them?
Sure. Great question. So right now, we feel like we are handling the capacity of calls that are coming in, and so we're obviously monitoring that all every day. And so our teams are working hard and certainly fielding a lot of calls, but right now we are able to handle the capacity. What I would ask is folks to go to credible sources of information. Go online to our website at the North Carolina Department of Health and Human Services, ncdhhs.gov/coronavirus. That's where you can get some of your basic questions answered, some that we've been going over here. All of that information is written down. And then what I would say is if anyone is having symptoms, if they're feeling sick, and they are concerned either that they've been exposed or have other kinds of clinical concerns, is to call their doctor or to call their local health department. And right now, we are being able to handle that capacity.
Right.
And do you feel confident of the test results? I know there had been problems with the reagents before, and we were getting inconclusive answers. Are we more confident with what we're getting now?
So for each patient, we run 2 samples, just to be sure. But we are still in a period where we are sending samples for confirmatory results to the CDC. So we are still in that process because this is our first week of testing at the state lab. We're still in that process of confirming to make sure that we've got it right. This is a new test. So we're still in that process. So this is why we've been calling these presumptive positives until we get that confirmation from the CDC.
You were saying that some folks, you're doing presumptive testing, like, checking to see if they have the flu, et cetera. I mean, is it possible to be co-infected?
It is possible, but highly, highly unlikely, right? And so that is why that is a helpful triage mechanism for us. We look for more common respiratory pathogens, other types of coronavirus that do circulate in the community, as well as the flu. Again, it is much more likely from someone in North Carolina to come down with the flu. We are in flu season than it is with COVID-19, so we want to check for those first because, one, we have medicines that can help us treat the flu, and we want to make sure that we're using those appropriately.
I know you said that the 2 cases are both still presumptive. Do we have an update on the status of the first one, and do we know when to expect the results back on both of those cases?
We're still waiting on both.
Can you just confirm one more time? You said in the beginning the number of kits you have available right now for testing?
Yeah, I want to get away from using kit because that confuses folks, but supplies. So we have about enough supplies to run about tests for 150 patients, right? Because I just mentioned we run 2 because we need the confirmatory tests. So I think just to make sure we have its supplies enough right now for 150 people. We believe we have enough supplies on its way to do another 500 again, but we don't have those in hand yet. We hope to have them soon, and then we've already ordered more to say whenever you get more, we want more. So we hope to be ramping up capacity.
And then you said that other people have been tested. Do you know how many other people in North Carolina?
In North Carolina, I would have to get you the number of how many we have tested. Mm-hmm.
Okay, thank you very much. We'll be back.